Welcome to the 50th episode of Community Health Matters. I'm your host, Amy Marsalis. Today we'll discuss a program that helps people with intellectual or developmental disabilities live as independently as possible. Health plans for people dually eligible for Medicare and Medicaid, and the opioid epidemic. All of that coming up next on Community Health Matters. From the News Channel 5 network, this is Community Health Matters, sponsored by the United Health Foundation. My first guest today is Tanya Copeland, and Tanya is really going to educate us more about services that are available for people who have intellectual or other disabilities, developmental disabilities, and this is open to any Tennessean if they are eligible, and there are some steps you have to go through. So tell me about this program, the name of it, and who can access it.
Okay, sure. So it's called the Employment and Community First Choices Program, and the program was actually designed for people with intellectual and or developmental disabilities. There is not an age limit. I think there's a lot of misconception that there is an age limit. There is not an age limit for the program. You do just have to have that intellectual disability, which has to be diagnosed before the age of 18, or the developmental disability, which has to be documented and diagnosed before the age of 22.
Okay, but then is this something that you would be involved in and participate in this program for an unlimited amount of time, or does the program last a certain length of time?
It's going to be individual. So when you talk about the program, you're going to look at it based on that individual circumstance. So you have people who we bring into the program who we are able to successfully help find employment or successfully find housing and become more independent, and those people roll off of the program. Then there's some people that we have who need more services and more care for long term. So you'll have those people on the program longer. So it's really more individualized, and it depends on where they are each year as they progress through the program.
Okay, again, the title is Employment and Community First Choices Program. Choices capitalized here.
That's exactly right.
That's very key, isn't it? To kind of elaborate on, there are choices here.
There are choices, and I want to elaborate on one more thing. So you have the Employment and Community First Choices Program, but you also had the Choices Program, which which was implemented back in 2010, and that's for the elderly and the disabled, the physically disabled. So I don't want people to become confused. So you have the two programs. This program, Employment and Community First Choices, is actually new. It was implemented back in 2016 for people, again, specifically with intellectual and developmental disabilities.
Okay, so how does this help people with employment?
And it doesn't just help people with employment. So it's called employment, the key word there, employment and community first choices. So one of the things that we really want people to know is that people with intellectual and developmental disabilities can and do work in meaningful jobs. There's often not an opportunity because people don't give them the chance to work in those jobs. So the Employment and Community First Choices program is as much about educating the community and your employers in the community as it is about finding people with intellectual or developmental disability jobs.
So you're looking at both ends of the spectrum here. So does that mean that you work with companies, businesses?
We do.
Okay, how does that work?
So
I'm going off on a tangent a little bit.
Each of the MCOs, because there are 3 MCOs who participate in this program, we each have what we call an employment specialist. And that employment specialist not only works again with the people, but they also go out in the community and try to work with our employers, educating our employers about people with intellectual or developmental disabilities and the skills that they have and the opportunities that they're missing when they don't employ people with intellectual and developmental disabilities.
They could be a very valuable part of our workforce in the state.
Absolutely, especially with the unemployment rate as low as it is.
Yes.
This is a resource that people have overlooked for a very long time.
Great point. How does it help improve people's living situations to be independent, obviously, and not have to live with family members, with their parents or whomever?
Well, I could take up a whole section, a whole segment on the number of services that we have in Employment and Community First, but there are services that we have there too that are like, that help build on their independent living skills, and that's one of the services that we provide. And the ultimate goal is to make sure that that person has the skills that they need to be able to support themselves if they need to, or if they don't have any other resources. So it builds on that. We also have what we call community living supports, and that's housing, or that's that's what we call a residential setting where a person may need assistance with that, and so we help them with that. There are over 40 services that are a part of the Employment and Community First Choices program.
How about that? I had no idea that many. That's quite a few. Okay, as far as any financial limitations, is this for people who maybe are limited in their income, lower income, or not?
No, so I don't want people to get stuck on, well, my income is high, it's above the federal poverty level. We don't want you to get stuck on that. The one thing that you have to have, or what has to happen for you to be eligible for the program, is that you must have an intellectual or developmental disability that I mentioned first. Then there are a number of other eligibility criteria, so you don't want them thinking about the income and not applying for the program.
Gotcha. What are the kinds of jobs? Give me some examples.
Oh, well, let's see, we have people who we support who work in all kinds of jobs. So we have people who are working at companies like Airmark. We have people who are working in, we have a young lady who actually works at the Grand Ole Opry. She's one of the greeters out there. Just any industry, the people can work. There may need to be some modifications for them, but that's why we're there, to help those employers, to help those businesses understand what we will need or what the person will need, and we try to help them to accommodate those things.
So that relationship continues. It's just
Absolutely.
a continuum from start to finish. How do people apply for the program? Let's say you're a parent watching, you've got a young adult living with you that you think is just ripe for this program and would benefit greatly. How do you connect the dots?
Well, you connect the dots in a number of ways. So if they have, say for instance, UnitedHealthcare, you look on the back of your card and you call that 1-800 number, and we can help walk you straight through the process. That's the same with the other two MCOs as well, with Blue and Amerigroup. If they do not have TennCare, or if they do not have Medicaid, then they would contact the Department of Intellectual and Developmental and Disability Services to be able to start that enrollment process.
Okay, and we're showing these numbers. We might put those back up on the screen in a second, so in case you didn't get those numbers written down, you can still get those before we finish this segment. And as far as other information about the program, is there a website or another way to learn more about this?
There is. So you, of course, can always find information on each of the MCO's websites about the Employment and Community First Choices program. But another good resource is the TennCare Long-Term Services and Supports website. And they will have a plethora of information for you about the program, as well as the online screening form, because you can actually apply through there as well.
Okay, Tanya, fascinating. Boy, the work you're doing. Thank you so much for coming in.
Thank you.
Appreciate it. And we will be right back with a lot more after this. My next guest is Roy Smith, and Roy is going to talk to us about something that a lot of people probably aren't familiar with. You hear about Medicare, Medicaid, but this is a dual special needs plan, or DSNP for short. Okay, so Roy, educate us. Tell me about this and who it really benefits, who's eligible for this program.
Okay, a dual special needs plan, or DSNP for short, is a Medicare Advantage plan that provides health benefits for those who are dually qualified, meaning that they are enrolled in Medicare and they are entitled to full Medicaid support.
All right. Are there a lot of Tennesseans who fall into that category? How many of our people qualify?
In Tennessee, there's roughly 260,000 people who are dual eligible in Tennessee. And of those, about 102,000 are currently enrolled in a Medicare Advantage DSNP plan.
Okay, so a lot of people are not taking advantage of the plan, is what you're saying.
Yes.
Why is that? Why are they not aware of it? Or
Amy, I think a lot of times people are not aware of it, or they may think it's too good to be true, the extra benefits that they're entitled to.
Okay. So how do you reach them besides programs like this? How do you get to that population, and who are they?
Well, who are they first? Let's start with that.
Yes.
These are generally going to be people who are entitled to Medicare, so they are either 65 and older, or they qualify for Medicare because they have a disability.
Disability, all right.
Correct.
Okay.
And then they're generally of low income, so they're entitled to the full Medicaid benefits. And so for us to reach that population, we have to go out into the community and meet them where they live.
So community outreach is critical.
Community outreach is very critical.
So you're talking door to door? I mean, or
well,
events at libraries or wherever, public places?
We work within the community to make ourselves available. We try to do as much education and outreach as possible so that people can understand what is available to them.
Is it more of a rural issue, urban issue? Is it both?
It is actually both.
It's both.
The dual population, some people think of as being primarily just older people, let's say, because of the Medicare component, but roughly 60% of our members are actually under the age of 65. Many of them may have a pre-existing intellectual disability or developmental disability, perhaps they have behavioral health needs and so forth, and so we're able to work with those individuals to provide a coordinated level of care that generally provides greater health outcomes.
Okay, so give me an example. You said a lot of these people think this is too good to be true. This cannot be real. So what are some of the services that you provide that people can't believe they can get these?
Well, by law, all D-SNP plans have to cover everything that is covered by original Medicare.
Okay.
So that's your Medicare Part A, which is hospitalization, Part B, which is your physician services and durable medical equipment and so forth.
Okay.
And then these plans also, most of them will include your prescription drug benefits, which is Medicare Part D. But in addition to those benefits, they offer benefits such as dental, vision, hearing, transportation, over-the-counter benefit, even some plans have gym memberships.
Oh my goodness, I'm reading on the screen. If they'll keep that up for a second. No monthly premium.
No monthly premium.
Coordinated care and support.
And let me talk briefly to that,
Okay.
because of all the benefits, Amy, I think that's the most critical. These plans will provide a level of coordination between the Medicare benefits that the person is entitled to and their full Medicaid benefits that they're entitled to. So they don't have to navigate the healthcare system on their own. The health plan will reach out to make sure that all the providers that are treating this particular member, let's say, that they're communicating with one another. So that could be a primary care physician, it could be a specialist, it could be a behavioral health practitioner, it could be a pharmacist, it could be a caseworker. The idea is to get them all communicating and working on an individualized care plan on behalf of that member that caters to the specific needs of that member. The result of that care plan is generally better health outcomes.
Sure.
And that results in cost savings. And the insurance plans can then take those cost savings and roll them back into the plan for extra benefits.
That is tremendous. And I also was thinking as you were saying this, it's a maze. Healthcare can be a maze for those of us who don't qualify for those programs you've just mentioned. But if you find yourself in that position, I mean, to have all of that coordination is a beautiful thing and really helpful.
I often will tell people that usually when it comes to navigating the healthcare system, it usually falls on the spouse, and if the spouse isn't available, it falls on the oldest daughter.
Yes.
And then if it's not the oldest daughter, it's the daughter-in-law. They'll go through the ladies before they go to the sons.
Yeah, I think that's true in many, many cases. And the transportation is a big element too.
Transportation, most of these plans do offer transportation. So whether it's taking someone to their doctor or to the pharmacy for their prescription drugs.
Yeah. Oh, this is tremendous information. Where can people apply for this then?
When can
Where? Or when? I'm sorry,
okay.
when? I meant when. Is there a
There
time?
have been some changes in that. In previous years, people who were qualified for D-SNP plans could make plan changes all year long. That has changed for 2019.
Okay.
Starting in 2019, D-SNP eligible members will have will be using the annual election period, AEP, which runs from October 15th through December 7th, just like every other Medicare beneficiary.
All right.
In addition, new this year in 2019, there is what's called OEP, or Open Enrollment Period, which runs from January 1st through March 31st.
Great.
And then they will have 3 other special election periods that they can utilize. One for quarter 1, one for quarter 2, one for quarter 3.
Okay, great. We need to wrap up, but thank you for really important information for a big
you're-
part of our state.
You're most
Thank
certainly
you
welcome.
so much. Thanks for coming in. And we'll be back with a lot more right after this. Every 13 minutes, someone dies from an opioid overdose, a very sad statement. My first guest knows about this all too well through her profession. Dr. Tiffany Peggs is with us. UnitedHealthcare Community Plan of Tennessee is who she's with. Great to have you, Dr. Peggs.
Thank you.
Let's talk about what exactly is an opioid. That word is thrown about all the time. We hear about opioids on local news, national news. We know it's an epidemic. But what exactly is an opioid?
An opioid is a class of medication that is used to treat pain. There's many different types of opioids that are out there. So there's Vicodin, Percocet, methadone, fentanyl, and there's dozens of other names. Opioids are used to treat moderate to severe pain. So after a surgery, or if you've had an accident, or if you have suffer from a disease like cancer, for instance, you might be treated with an opioid to treat either your acute or chronic pain.
Okay, so I've heard of all of those that you've mentioned. They've been around for a long time. Why now is there this problem of people overdosing when these medications have been around and people have been taking them for pain? Why now?
That's a complicated question
Yeah.
with a very long, complicated answer. The rise of opioid misuse and abuse is a multifactorial issue. At the heart of it is the misuse of prescription opioids. Misuse meaning you're using it, the medication, outside of what your doctor or prescriber is giving it to you for, or not for the reason why it was prescribed to you initially. That has led to babies who are born with opioid dependence. That has led to the crisis that we have now. We've been studying opioids for more than 20 years now, and as this crisis has increased, and what we've seen is between 1999 and 2015, there's been a 400% increase in opioid deaths in women, and a 200% increase in opioid deaths with men. So there's no simple answer as to why now, but we have realized that this crisis is upon us and that we have to do something about it.
It is devastating. It is absolutely devastating. I think 60 Minutes just tackled this recently as well. So there's not really one specific cause, or obviously there's not one answer, and I know that everyone is studying this in this particular field. So what are you doing at UnitedHealthcare to address the crisis?
UnitedHealthcare, we are committed to the opioid epidemic. We are attacking this on all fronts. We are partnering with primary care physicians and specialists in your community to increase awareness and educate physicians on how to treat pain acutely, and then how to also taper people off of opiates if they're needing that assistance. We're partnering with communities to make them more aware of what opiate addiction looks like, and internally looking at data analytics to try to get to the bottom of how can we effectively treat this epidemic, what's working and what's not.
What does it look like? I mean, I think in my own mind, I know of a case, not even in Tennessee, but where someone had delivered a baby. She had a back injury, and it was exacerbated by childbirth. And that child is now 10 or 11, and she is still taking pain medication. To me, that is the face of opioid overdose. or not overdose, but of a problem or dependency, but I'm not a medical professional. Is that an example of what it might look like?
That's one example, but I don't want to overlook how broad opioid misuse and abuse and addiction can look like. It can be the person who does have legitimate pain, but also has not tried or been tried on or even offered alternative pain for their long-term treatment. It could be the person that started taking it for a legitimate reason and then escalated to buying it from the street, taking it from other people, or even worse, escalating to heroin or other substances. So opioid addiction can start many different ways, and it usually does start with a legitimate injury or reason to take it. And the problem is that opioids are addictive, and you don't know how addictive they're going to be for you, and we can't predict that. However, we do know that continued long-term use increases that risk of having the addiction and dependence on the medication.
And there are safe alternatives, and there are things that can help address the pain these people are in.
Yes. Now, I don't want to say that it's a one-size-fits-all for treating pain, but luckily there are many options, and even many more options are available these days. I would say that one, and the most important thing to tell people is, if you have an acute injury, you get a bottle of opiates, you don't need to finish that bottle. Once you start to feel better, ask your doctor about, hey, I'm taking this medicine, I'm starting to feel better. What else can I take that will not have the addictive properties, but also going to treat my pain as I continue to get better? Also, too, for people who have chronic pain, there are a myriad of other options to treat their pain. There is chiropractic therapy, there's massage therapy, there are alternative pain, there's cognitive behavioral therapy, and these are time-tested and treatments that work. So I don't want to undersell them as, you know, this is something that you can try, this is something that has been proven to work, and if it's something you're interested in trying, then you should talk to your doctor about it.
That is just invaluable information you just shared with us. We know some people are really at risk for addiction, and so it's critical for them to know this. How do you get rid of opioids properly in our last few seconds?
I'm so glad you asked. We have take-backs, and we are hosting a take-back April 27th. You can go online and look for your take-back center. There's going to be some all over the state, all over the country, and you just go, take your medicines, and they'll take care of it for you.
Dr. Peggs, thank you so much. Appreciate your time. And thank you for watching today's 50th episode of Community Health Matters. Learn more ways to improve your health on our website, mycommunityhealthmatters.org.